Her smile hides a nearly year-long dance with depression and a drug that she says almost destroyed her.
I don't know if I really wanted to die or if I just wanted to get away from everything, or it was just like I didn't want to deal with anything.
In March, 16-year-old Nicole Perez tried to kill herself. The girl who went for help for an eating disorder swallowed 25 pills of Effexor XR, the very medicine a psychiatrist had prescribed to make her feel better.
Like I couldn't deal with it. It was just like, oh, the medicine's not working, the therapy's not working. It's like I can't do this anymore.
Nicole survived and is still going through withdrawal. She and her parents now know the antidepressant she was taking for 6 months was not approved for use in children by the drug's manufacturer. Prozac is the only antidepressant approved by the FDA for use in treating children with depression, but it's still legal for doctors to prescribe Effexor XR and other antidepressants to kids.
When I first started seeing doctors, the first thing they were like, take the medicine. And that was like the first thing they said, and that's the first thing I did, but it did not work out at all.
Back in August 2003, Wyeth Pharmaceuticals sent this letter to doctors about Effexor and Effexor XR, saying, quote, safety and effectiveness in pediatric patients have not been established. In pediatric clinical trials, there were increased reports of hostility and suicide-related adverse events.
It's like this war between your body and your soul.
Despite the warnings, the drug continued to be a part of Nicole's treatment.
You know, how many other parents are out there with their souls broken because they will never be able to ask the kids, why did they did it? Why did they kill themselves? You know, how many parents will never know that answer? We are the lucky ones.
Oh, Mommy, look here.
In March, 10 days before Nicole Perez tried to take her own life, the FDA issued this public health advisory, urging drug makers to add new warnings on labels of Effexor XR and 9 other popular antidepressants like Paxil, Zoloft, and Prozac. The warning alerts doctors and consumers to watch for signs of worsening depression or suicidal thoughts among adults and children. It's the risk to children that worries South Florida psychologist Barry Duncan.
No one knows the long-term effects of introducing a chemical to the brain, to a developing brain. There are no long-term studies that say what happens.
Duncan says the FDA should have gone one step further, following the lead of the British government, which went beyond warnings and last year advised physicians not to prescribe the most widely used antidepressants to children.
There are just too many risks associated with it, and they haven't been proven to be effective or safe with children.
According to a study in the April 24th issue of the British medical journal The Lancet, no drug except Prozac is proven to ease depression in children any better than placebos or sugar pills. And the study found, except for Prozac, the risks of these drugs outweigh the benefits. When I asked Dr. Robert Temple with the FDA about the Lancet findings, he told me by phone, quote, "We don't think the evidence supports the ideas that these drugs should be banned or contraindicated. These drugs still may be effective."
And I say that logic is like saying, you know, depression can kill you, let medication help.
The rate of suicide has...
But here at Jackson Memorial Hospital, Dr. Eugenio Roth has seen only the benefits.
In 14 years of practice in child and adolescent psychiatry, I have never seen a child become suicidal as a consequence of the medication.
Dr. Roth runs the busiest child psychiatry clinic in the southeast United States, with more than 10,000 visits a year from children as young as 3. He's found antidepressants work well for children if combined with other treatment.
What I have seen is that many children who are depressed and do not receive the necessary wraparound services, which include psychotherapy and family therapy, do not respond adequately to the medications and continue to become more depressed.
Federal drug regulators tell me they don't know of any current clinical trials for depression involving children and antidepressants. But our CBS 4 News investigation found one South Florida company conducted such a trial as recently as 2 months ago on children as young as 6 years old.
Siegel Institute in North Miami is paid by the pharmaceutical companies to run drug trials, recruiting children in part through advertisements like these. Dr. Edward Burdick says he's supervised more than 150 trials here, 3 of them dealing with antidepressants and children. And he says there are plans pending to conduct a 4th.
Right now, when the jury's still out on exactly how much damage these medications can do, wouldn't it be advisable not to test these drugs on a child as young as 6 years old?
I would not, in most cases, without seeing all of the information, feel that at this time any studies such as this should be done in 6-year-olds.
But Burdick says he has no problem with older children taking part in trials because he says the paid participants undergo rigorous pre-screening and weekly doctor visits.
Each take-home exam is 15%.
Still, critics like FIU sociology professor David Cohen say until the FDA completes further research, there should be a halt to these trials, even for teens.
If there's no demonstration that the drugs are effective in adolescents, exposing them to extra risk is not warranted.
Congress is now investigating the FDA's role in the use and testing of these drugs. Representative Jim Greenwood has called for the FDA and drug manufacturers to supply internal data to see if information linking antidepressants and suicides in children was kept secret.
We just want to make sure that parents and clinicians and doctors have all of the information so that they can feel comfortable that they're not putting any children at risk.
The parents of Nicole Perez just wish their little girl did not have to learn one of life's toughest lessons the hard way.
I just wouldn't recommend it to anyone because happiness really doesn't come from a pill.